My work is primarily liver. I trained as a gastroenterologist, but liver then became a very large field, and that's what I've really specialized in. And I really picked liver in part because at the time it was a fairly unknown area, but an extremely important organ that did lots of really interesting things, and people didn't know very much about it. And I actually started my career with a lot of basic science research into how the liver worked. I see my job in two parts. One is being the detective, working with a person to try to figure out what's going on, what's wrong, how we can better manage it. But the other aspect is my job as an educator. And this is something that in the last 15 years or so has really taken on a major part of my life and is a major area of my interest. In terms of medical student teaching, that's one thing I do, but another thing is trying to educate my patients. And I think that's been something that I've developed and improved on over the years. I think it's so important for patients to have a better grasp of what's going on in their body and why is it happening and what happened to make things go wrong. And in that case, it's easier for them perhaps to understand why we have to do what we have to do to help them out, either to make the diagnosis or to treat them and monitor what's going on. So over the years, I've developed interesting educational handouts for my patients and tried to work with them. I spend part of my time in each clinic drawing pictures of anatomy, help them see the connections, particularly in the liver, and why the process is happening. And that's just been a fascinating area. And I really enjoy that interaction with my patients.